We all have pain, but do we even know what pain is? What is pain? We know it when we see it. Can you give me a definition? Kind of hard to define, right?
The absence of pleasure.
Yes, it's pain. Absolutely. Yeah, so you can have all kinds of pain, certainly. The International Association for the Study of Pain have basically diagnosed it as something that is an unpleasant sensory and emotional experience. So sensory and emotional experience, it's unpleasant. So essentially,
Do we have John? Do you have the speaker? I mean, or is he can use one of the.
you want me to use a microphone?
Please.
Hello? Okay, good. The International not a sign of something big and scary, right? So, okay, I'm thinking maybe cancer, I'm thinking maybe fracture, I'm thinking an infection, something is off. We need to make sure that it's nothing to worry about and it's just simple pain, right? But that being said, pain is a function of health. Now, we can break it down even further, and that is the term nociception. So nociception say ow, and that process is nociception. Kind of a different aspect than pain, right? Pain, as we know, is a sensory and emotional experience, and of course the definitions of that are wide-ranging and can be applied in many different ways. So, but nociception is very specific. This is important to understand because nociception really is just this part of the brain, the somatosensory cortex. And we have two of these, one on each side, and it affects the contralateral side of your body. So that's where the nociception component of your pain is processed. Whereas the other side of pain, the affective side of pain, right? So that's where you get the emotional response, the depression, the anger, the outrage, the flat affect, all of that gets processed in the anterior cingulate cortex. So that's in a different part of your brain. And so, again, both of those will make up pain, but only one of them tells you exactly where. So this is kind of interesting. They did a study on this, and they looked at patients that had strokes or various lesions involving these particular parts of the brain. And what they found is that if you took out the somatosensory cortex, they had pain, they felt horrible, but they couldn't tell you where the pain was. And it was very strange. Alternatively, if you took out the anterior cingulate cortex, they knew exactly that their arm was on fire, they just did not care about it. So, very strange the brain is, right? But that again should help differentiate, nociception from pain and really feed into the diagnosis of what pain is. So, really, what I do and what most pain doctors do, we treat nociception. You come in and you hurt yourself, we do a nerve block, we put a stimulator in there or whatever have you, and we block your body's ability to receive that pain signal. Rarely can we have the opportunity to really treat your pain because that's very complex. It takes a long time and a lot of understanding. So if pain basically goes unchecked, right? Again, we have this emotional and sensory response. We have these natural responses over time. So catastrophizing. We will basically say, you know what, this pain is going to end me. I'm never going to get better. I'm going to lose my job. My friends are going to not want to hang out with me, and nothing's going to work, right? So that's catastrophizing. Again, anterior cingulate gyrus, coming from that part of the brain. Feeling helpless. You get depressed, hopeless, anxiety. But really, what all of this is fear, right? You boil it down to its most basic emotion. It really is just fear. And again, that's fear that you're never going to get better, that you're going to live with this the rest of your life, and it's going to be very miserable, very scary experience. Anybody been in a very painful experience? Were you scared out of your mind? Maybe not right in that moment, but it was there, I'm sure. So the approach to chronic pain then, not nociception, right? The approach to chronic pain, really you have to evaluate the whole person because again, it is a whole person experience, right? So stepping outside of just the physical aspect, you have the emotional being, the social being, and the spiritual being, right? And so each one of these really involves, and you can get psychologists, social workers, pastors, right? It does take a community to isolate our approach. Well, I had someone ask me the other day, a colleague of mine who's not a pain specialist, but very educated in her specialty. She asked me, what do you think is the main cause of pain, right? And I'm just thinking in my head, well, she's probably wanting me to say inflammation or something along those lines, or diet, right, or whatever. But which is true. That's certainly a big component. But what actually hit my head first was something different. Sin, actually. That's really the cause of pain, right? And we were all kind of thinking it, right? So going back to Genesis, this happened immediately. That was one of the first things that happened. Lord God called to Adam and said to him, "Where are you?" So he said, "I heard your voice in the garden and I was afraid because I was naked and I hid myself." So the pain of, again, fear. And that was the first thing. And then shortly after, child labor was made more painful. And then Adam had the curse of toiling in the fields. And so, again, multiple different types of pain, but that's when it was introduced, when we first said, by God, and we walked over here, away from the person that gives us life and healing and sustaining existence. That's when pain came in. So, really, if you want to get to the root cause is sin. So, if we're going to look at treating the root cause, then what is the solution to sin, right? So, anyway, really pain is just a spiritual thing, and my job is really moot. I should have been a pastor, but nonetheless. So, here's why it gets interesting. Okay, it's about to get interesting. Okay, hold on to yourselves. So, what you see on the left side of the screen is a normal, healthy-looking spine, okay? You see the vertebral bodies, the blue discs in between, the yellow nerves coming out the side, okay? On the right side, you see basically a bunch of arthritis, right? All these crusty bones growing off and pinching the nerves, and the discs are collapsing, and you get bone-on-bone erosion there in the vertebral bodies. Looks like it would hurt a lot, right? Absolutely. So, 3% of people aged 20 or so have exactly the spine on the right, 3%. 80% have it over the age of 40. Now, 80% of people don't have chronic pain. And so they've studied this, actually multiple studies. What you see on the right does not correlate with any painful syndrome at all. You can have just as many people have it and not have pain, and just as many people have the spine on the left and have a tremendous amount of pain. So, why do we get MRIs? Again, we want to rule out anything big and scary. And if you have a pain syndrome that's very specific, we are hoping that we can find one little disc that's pushing on that one specific nerve, and that maybe explains what's going on. Again, nociception. But most of the time, it looks like it is on the right. And we're like, well, I think it's here. Let's try that. Right? So, again, the MRI, and I have to educate patients a lot on this too. They'll come in. I'm like, well, what does your pain feel like? And they say, well, I've had this herniated disc for 20 years. Stop right there. That really doesn't mean anything to me because, number one, discs come and go, but number two, I know that you're going to have a herniated disc. There's an 80% chance of that, and I know it's probably not causing your pain. Could be, but maybe not. So, that's kind of the interesting thing. I educate patients because you can get into your head that I always have this herniated disc, and so you're always going to continue to think that you're going to have back pain because of this issue that will never go away, and it, again, kind of catastrophizes down the road, right? So it's okay to have a bad-looking spine. That's the point. Separate that from feeling pain. That's the good news. Okay. But that is interesting. So what is causing your pain? That's what it boils down to. Well, a 2005 Stanford survey found that people were clear on where they hurt, but often couldn't link that pain to a specific cause. You know, we often think if we throw a back out, that it's because we lifted a mattress, we were in a car wreck, whatever the case is, but most people can't. In fact, there's at least 2 studies that go up to 85% of people have no idea how they got their back pain. They just know they have it. And speaking from personal experience, that seems to be the case. So, what does the Bible have to say about that? Psalm 38, there is no soundness in my bones because of my sin. My guilt has overwhelmed me. Verse 7, my back is filled with searing pain. There is no health in my body. So, wow. So there's a differential diagnosis right there of what your back pain might be, right? It's sin. And it goes back to, again, why we were all in this position in the first place. I like this too because, again, it illustrates pain and health. So there's no health when there's pain. So again, pain is a symptom of being unhealthy. Maybe it's more than just physical health. The solution James offers, therefore confess your sins to each other and pray for each other so that you may be healed. Right? So going back to that Stanford study, in a surprising look at what works for pain relief, researchers found that just as many people cited prayers as prescription drugs. So there you go. I love it when the Bible and science just come right together. Dr. Scott Brady reported in his book called Pain Free for Life, those who prayed or studied the Bible at least daily had consistently lower blood pressure than those who did so less frequently or not at all. A 2001 study published in the American Heart Journal found nearly a 30% reduction in heart procedure complication rates when prayer and related responses were employed to reduce stress and anxiety. Now, all of you haters out there might just say, well, that's because they're meditating and that lowers your blood pressure, of course. But here's the fun part. The greatest effect was seen in those assigned to off-site prayer sessions. They didn't even know they were being prayed for, and they still had less complication rates. Harold Koenig, that's a name you need to know. So he looked at more than 1,200 studies examining religious activity and health, and found that at least 2/3 of them revealed significant associations between religious activity and better mental and physical health. So that means that you had better outcomes in a lot of different things, including chronic pain, but also blood pressure, immune system function, depression, and your overall chances of dying. I think that means overall chances of dying prematurely. Obviously, we don't die, but... So again, the conclusion was that the evidence shows an inverse relationship between intensity and between pain intensity and both religious beliefs and religious attendance. So again, come into church today, if you have pain, the science shows you will have less pain because of it. So that's a great thing. But why? It's kind of interesting. Why? What's the scientific reason? Again, today's time, you could write books about this, and people do. So I'm trying to keep it very simple and conceptual. But the why answer probably boils down to 2 columns that I was able to think of. So chronic pain, meaningless. There's no biological, evolutionary advantage to chronic pain. There just isn't. Nociception, sure, you can make that argument, but chronic pain is meaningless. It's just suffering. Why would we suffer? What do we have to gain from suffering? Nothing. What do we have to gain from Jesus? Obviously, everything. It's the entire meaning of why we are here today, right? So it takes that out of the equation. Chronic pain is purposeless, right? Again, it's not doing anything, and yet we're filled with purpose through Jesus. Chronic pain is extremely limiting. We all know that. We can't move, we can't do this, we can't do that, and yet we can do all things through Christ who strengthens us, right? It goes on long enough, you start to lose your sense of identity, because again, you're not functioning in the roles that you need to function in because of your pain, right? And so you lose your sense of self. But again, Jesus affirms your identity in the fact that you are a citizen of heaven. You are a child of God. And no matter what circumstances here, nothing can separate us from that identity and that love. So again, we're affirmed in that. Chronic pain is inwardly focused, right? Jesus is outwardly focused. So again, major shift in our perspective. One of the things I have a problem with in the hospital, if you've ever been admitted to the hospital, someone's coming in every 5 seconds. What's your pain number? What's your pain number? Well, I wasn't having pain until you reminded me of it, right? So, I mean, that's true. And I find myself doing that in the clinic too, because we have to have these numbers that, demonstrate what we're doing and all this. But again, it's important to redirect your attention outward. When people are outwardly focused and trying to help others, that's when they feel the best. That is the solution to depression. That is the solution to being lost in life, and also finding your identity. It's in helping others. Finally, chronic pain has fear, and Jesus offers peace. You can't get that with pills. Chronic pain is the result of sin. Jesus is the solution to sin. So think about that. I mean, in this way, it's my opinion that this is why Jesus has the solution to chronic pain. This is why chronic pain is the result of sin. It really is the foundational. Let's get to the root cause, of this syndrome. What you do from there, it can be pretty much anything. But without this, you can only do so many injections. You can only do so many pills. You can only have so many side effects before you blow up and nothing gets better. This is the solution. So I have a lot of patients ask me, well, if God said, no, you still need to have your pain, right? That's the hand you were dealt with in this life. Can you still have a meaningful life? Because, the suicide rate is higher in those who suffer from chronic pain. And it's not because they're suicidal per se, it just means they are tired of dealing with this pain that nobody seems to be able to take away from. And that's a very scary place to be in. Well, I refer them to this verse, and obviously everybody should be familiar with the story of Job and everything that he suffered. Then I would still have this consolation, despite everything that he's been going through, losing his family and his health and his wealth and everything. He still has joy, despite his unrelenting pain, that he did not deny the words of the Holy One, Jesus. And those words boils down to love. And that's loving God, and that's our purpose. And with that, you can survive anything. So that's my verse I'm going to leave you on today. And I will open it up if there are any questions.
I just had a doctor tell me that actually about my immune problems. He said almost the exact same thing about how you show the spine, how you can have all the problems in the world, but might not have pain. But somebody might not have as much problems and have that pain.
Yes.
That was a new kind of like, whoa. Even though the MRI shows that, it doesn't necessarily mean it.
So if we continue to understand pain as an unpleasant sensory and emotional experience, then we have to, if the sensory component is the nociception, right? And then, okay, so then it's emotional. How are we processing all of these pain signals? We do know that, for example, and this could apply to anybody or nobody, but the literature shows, to give you an example of how emotions play a significant role. When, if you take kids who were abused in any sort of way, right? So we call these adverse childhood events, right? And the more adverse childhood events you have, now that might be your parents are divorced, or you witnessed your parents hurt each other, or maybe there was someone that was arrested, and so any kind of trauma to a child. The more of those that you have, the more likely you are to suffer from chronic pain when you are older, and that hits you younger, right? Because again, so much of this goes back to who you are, how you interpret love, what your idea of love is, where your place is in the universe, what's okay, not okay. So, again, a lot of this boils down to fear and distrust. And so all of these negative emotions just manifest into physical symptoms because it's all connected up there, And so that's why it's so important that we ground ourselves, because all of us, just watching the news, I feel like is a form of abuse that we're doing to ourselves, right? So if we're not grounded in some sort of greater reality, greater purpose, then everything is going to hurt. We're going to be freaking out at every second, and and so that's why it's important, and to at least broach that subject when you're working with someone who has a perfect looking MRI. Okay, what else is going on? Yeah, excellent point.
It's interesting how God
It makes it seem like it's a choice, which means that I guess that's good news. We could just have some insight and then decide. Maybe with multiple practice sessions we get natural at it, but it does seem easier said than done. But again, that just comes down to, I would say, surrendering everything that you are to Him and letting Him take over. A lot of times we try to hyper-control things. People who are in pain hyper-control. A lot of it is guarding. They don't want to hurt themselves anymore, whether physical or emotional, right? So they control their relationships, they control how they move, they control everything about them. They're very particular even about their medications. Not that